even if we delete this part probably later.
Okay, I'll kick off. So welcome everybody. I'm using my phone as usual, so I have limited kind of overview of who else is in the meeting. Peter, I can see you, of course, and I briefly saw Mehmet. Let me see. Yeah, and I guess, although I stand corrected on my pronunciation, we've got Xueling Xiao from the nursery school, Changsha's Central South University in Changsha. So welcome as our guest speaker. I probably had that pronunciation terribly wrong.
It's okay. You just read it correctly. Thank you for the introduction.
Yes. So just before we start, you're very welcome. This is our last Friday of the month open talk, organised by, in the first instance, by the HRUG and our esteemed colleague, Professor Peter Herman from. He's a research fellow in the Human Rights Centre in Central South University in Changsha, and we will the format of today, as in the previous last Fridays of the month. This new format we've established is to invite our guest speaker to speak on the topic, which is about care and respect in relation to research and disease management for persons with HIV and AIDS in China. So I'll be asking Dr. Xueling Xiao to speak in a moment, and after that I will ask other colleagues to make any kind of comments or observations or questions. So after the presentation, we will have a kind of an open discussion. So again, you're very welcome, Dr. Xueling Xiao from the nursery school in Changsha, and I now invite you to make your presentation on care and respect for in relation to disease management for people living with HIV and AIDS in China. Thank you.
So thank you for the introduction. I will share my screen first. I have prepared some PowerPoint. Can you see my PowerPoint now?
Yeah, it's a bit small, perhaps.
Okay, yeah. Does this work now?
Yeah, perfect. Thank you.
Okay, yeah. So thank you so much for the introduction, Professor Zhou. And also I'd like to say thank you, Professor Zhen, for the invitation. So Xueling Xiao, and you can also call me Sharon. I will actually, I'm just focusing on the HIV and HIV prevention and management topic. So I'm not very familiar with human rights things, but I think as Professor Zhang said, this topic can be very significant to show how our country and how this society cares for this vulnerable population. And today I will give my topic focus on these two perspective. First is the HIV epidemic and policy. And second, I will give some brief, very brief introduction of our research. So till the end of last year, globally, there are about almost 40 million people were living with HIV. And just in last 1 year, there were about 1.3 million people get newly HIV diagnosed, and about 630,000 people, HIV infected people died because of HIV or HIV-related illness. So talk about the epidemic in China. Also till the end of 2023, we have about 1.29 million people living with HIV. And in the last year, 110.5 thousand people got HIV. And so this is the epidemic. This is the number of our from the globally and also the China national level. And then I want to show something about the HIV history of China. So maybe all of you guys has heard something about HIV. So our first its case is in the 1985, and the first outbreak was among the people who used the injected drugs. And the second outbreak is about the among the people, among the plasma donors. And nowadays, till the year of 2007, the sexual contact has become the first risk of transmission. So this is the three main transmission mode change in our history. And during the changes, we have some policies for the HIV prevention and also HIV management. So first, in the year of 1995, our government has launching HIV surveillance, and it was started in the hard copy way, and then till the year of 2003, we have the electronic surveillance reporting system. So I will introduce it later. And also, for the different risk population, we have different policies. Since the second outbreak is among the plasma donors, so we have launched the blood donation law, and also for the people use injected drugs, we have initiated the needle exchange program, because for the people use drugs, they always got HIV from the blood, because when they injected the drugs, they had no money to buy new needles, so they reuse others' needles. So during this process, they may got HIV infection. And also, we have launching the pilot program for the prevention from mother to child HIV infection. And also, till the year of 2004, we found that the needle exchange program is not effective enough. So we also launching the pilot methadone maintenance therapy. So this program helps the drug users to use the methadone instead of the injected drugs. So this will prevent the blood transmission of HIV. And also, this is also some policy examples for the HIV prevention. And for the people who are already get infected, we have some policy for them as well. One is initiated in the end of the 2003, and we called 4 freeze and 1 care policy. Is in Chinese 4免疫关怀, and I will also talk it later. And till the year of 2016, we have the policy so to facilitate the treatment of HIV people. So it means that if the people get diagnosed with HIV, so we will facilitate them to start the treatment as soon as possible, because the evidence showed that if they can initiate the treatment as soon as possible, they will benefit from the treatment, and also their lifespan can be as long as the normal people as well. And I will give some details about this policy change and this epidemic and policy change. So this figure shows one of the most important policy for the HIV prevention our government has conducted. It's called the scale up of HIV testing. So you can see from the yellow column, the newly diagnosed HIV population has increased year by year, and this is actually because one of the main reason actually is because we have scaled up the HIV testing. We have distributed the self-testing device to the high-risk population, and we also in some province we have some so people can get the HIV self-testing device free. So actually this helped us a lot to earlier detect the HIV infected people. And the second figure shows how the transmission mode change. So from the first case, you can see majority of the infected people were the drug users, and till the 2017, we can see that like more than 90% of the HIV infected people get infected because of sexual contact. The blue one means the heterosexual, and the yellow one shows the homosexual contact. So nowadays in China, the transmission mode has changed a lot, and so you can see that our policy and also our government has also noticed this change, and we have put a lot of endeavor to try to prevent the sexual transmission mode. And now regarding our policy, as I have mentioned, that we have established a HIV surveillance system. So we have this is the foundation of the surveillance system. So we have the Centers for the HIV and also STD, Sexually Transmitted Disease Control and Prevention Office. And we have various levels, including the national, provincial, and also district level. And all the three levels of the CDC office, they will organize and develop the policies and regulations for HIV prevention and control, and also provide some scientific evidence. And they also participate in development, implementation, and evaluation of the National Action Plan for HIV prevention and control. And the third one is regarding the surveillance system. They provide the technical assistance and quality control for national HIV surveillance and laboratory testing as well. Actually, in China, we have more than 10,000 labs can do the HIV testing. And this is the web-based reporting system. So this system provides the ability for direct reporting of diagnosed HIV cases from the grassroots hospitals or the district level CDCs to the centralized database in Chinese government. So namely, if people get infected, the healthcare providers will enter into the system, and all levels of the CDC can acquire the data levelly. So the people in the CDC system, they will know, one more people get infected, but the details, information, the privacy of the HIV infected people will be kept as well. And this system actually helped us a lot to make the reporting period from 1 week to less than 2 days. So this system helped us a lot to have a comprehensive picture of the national HIV epidemic, and also how the HIV infected people are very low, or their immune system function, things like that. So the government has a very comprehensive picture regarding the people with HIV, so they can have a better understanding of this population and made the policies or implemented some strategies accordingly. And the next one I want to share with you is about four freeze and one care. So I just mentioned 四免疫关怀. So this has been initiated in the year of 2003. So it has been almost 20 years. And so the four freeze is free HIV, voluntary counseling, and testing. So this means especially in the CDC office and also in some universities, we have some offices to provide the voluntary consent testing. So for example, if the students or the people who are at high risk of HIV and they may get some unprotected sex, and then they can just enter the office and do some counseling, and also we will provide free testing for them. And the second is the free treatment. It means, so we actually, for the HIV infected people, we have a lot of medicines for them, a lot of drugs for them. In China, our government provides some medications free for the patients. So no matter what kind of economic status are the patients in, they can get the treatment. And the second is a free prevention of mother-to-child transmission. So actually, for all the pregnant women in China, they can get a free test, free HIV test, and also if the female are HIV infected, they can get free medications and free counseling as well. And the fourth free is about the free education for AIDS orphans. So because as I said, the second outbreak of the HIV in China is among the plasma donors, and and also some child get infected from their mother as well. So our government has provided free education for these orphans. And the one care is financial assistance and social support for the people living with HIV. So for example, in Hunan, we have our HIV clinic, and also we have HIV inpatient department. So people who are very poor or who have some economic issues, the government and also the hospital management system will notice that, and they can apply some money for them to support their treatment. And also, besides the four freeze and one care, we have provided the free HIV variant node test for the people with HIV as well. Because in China, the HIV variant node test is kind of expensive for them. Like it's almost more than 1,000 RMB. So some of them cannot afford this test. But this test is also very important because it's a direct indicator for the treatment effect. If the virus in their blood cannot be tested, it means the treatment is effective. Otherwise, maybe the treatment regimen should be changed. So our government has also initiated the free HIV variant node test for them, but the frequency of the free test is different from each province. For example, in Shenzhen province, actually they provide the patients for like 2 to 3 times per year. But in Changsha, we just provide one free test for them. So this is what we have done for the HIV prevention and control topic. And also, globally speaking, the UNAIDS, the United Nations of AIDS, has proposed that we need to end the HIV epidemic till the year of 2030. So before that, there's also a goal called 395%. So it means that till the year of 2025, we need to we need to have like 95% of the HIV infected the people be aware of the HIV diagnosis. So this is why our government has initiated the scaling up of the HIV testing things. And the second 95% is about that. So for those who have been diagnosed, at least 95% of them should get the drugs. And the third 95 is about the very surprised. So after they get the drugs, as I said, they will have the HIV variant node test each year, and this will reflect how the treatment works for them. So the third 95% means that 95% of the treated people with HIV are in the undetectable variant node status. So actually, our national endeavor and also our group has worked very hard actually to try to achieve the 95%. So the second part, I will give some brief introduction of our research. So our group has mainly focus on the HIV management part. So we want to make some contribution for the second 95% and also the third 95%. So we have focused on the initiation of earlier HIV treatment, and also we have focused on how to promote the health status of the patients. Actually, very surprised status is just one of the indicator of their health status. So for the first topic, initiation of earlier HIV treatment, when our group has started the HIV management related researches in maybe from the year of like 2004, I think, because my mentor, she is one of the first she initiated the HIV researches focus on the drug users. So we have conducted the HIV management researches for a very long time. So during our during our researches, other researchers contacted when we have talked with the patients, we found that the early HIV treatment is not very popular among this population actually. So when we talk with them, some people told us that they don't want to start the treatment after they know that they get HIV infected, because they think that if they get the medication, it may means that I was definitely being diagnosed, being infected by HIV. This will make them feel depressed and feel like to have some suicidal ideas as well. So we found this is an issue. So we have do a secondary data analysis first. So we have also published this paper. So the meta-analysis showed that the prevalence of delayed ART initiation was about 36%. And so the data confirmed us that the late HIV treatment initiation is actually an issue. So we conducted a survey to try to explore why these people do not want to start the treatment immediately. So we have explored the potential mechanism, and we also have conducted some quantitative survey as well. And for this problem, we have got funding from the National Science Foundation of China, and this project is focused on to facilitate the ART treatment. We have actually this project is mainly the study setting is mainly in Hunan province. and we have covered like more than almost 5 cities, and we cooperate with the CDC office because the CDC office will give the HIV confirmation test for the potentially being HIV infected people. So we can we can contact them, and also we do some behavioral intervention, try to facilitate them to start the treatment as soon as possible. So this is the first topic. And also, actually, it's my PhD project. I focus on the disease adaptation. So actually, because of the treatments, the patients can actually have a very similar lifespan as the HIV negative population, but they need to live with HIV in the whole time, so they may suffering from their daily life. So I have talked will do the quantitative interview with with more than 40 patients, and I have deeply explored their experience, why they can have the normal lifespan, but why they still feel depressed, and why they still cannot have the normal life as others. So I have done this interview, and I found that the patients had suffered from, besides the physical status, and they have also suffered from psychological things such as depressed, PTSD, and also anxiety, and also some social network tasks, such as because the HIV patients usually they may not tell others that they were HIV positive, so they have less social support than others. And also they are suffering from the vocational things and also the spiritual things. So actually, this whole picture helped me a lot to develop my intervention. For my PhD program, I have developed an intervention like 10 weeks. It's a hybrid intervention program. Each week I have an online module and also some offline module. I talked with the patients and especially regarding their adaptation tasks. And also we will give some suggestions and also some informations and also some techniques, help them to overcome their tasks. So I have also conducted a pilot test. The test showed that the hybrid intervention has increased their quality of life. And also we our group has focused on other symptoms as well. And also we have explored a lot regarding the adaptation mechanism. For example, I have focused on the ways of coping and also the ways of coping between the self-efficacy and also the acceptance of illness. And during that time, we found that there is a risk for the HIV population to transmit HIV to others as well, because they may conduct some unprotected sexual behaviors as well. And during the unprotected sex, they may also get other sexually transmitted disease as well. So this will in turn to decrease their HIV, their health status as well. So for this issue, we got another NSFC project, and now we are during our pilot intervention test step now. So this is some brief introduction of what we have done for the HIV patients. So in summary, from my perspective, I think that actually, we cared for this population, including the people, the high-risk people who may get HIV infected. Actually, we have a small group. They have focused on the HIV prevention, especially for the men who have sex with men. And also we have a small group focused on the HIV patients. We have conducted a lot of research to facilitate them to manage their symptoms and facilitate their adaptation outcomes. And also we respect this population. We talked with them and we learn from them actually. Majority of our intervention contents are from the experiences of the HIV patients. And also we worked hard. We know that for the HIV patients and for the HIV prevention, we still need to work for a long time. So, but we will work hard to try to achieve the AIDS by 2030. Yeah. And this is the end of my presentation. And the next slides I want to see my project. Besides HIV prevention and management, I also focus on the maternal and child health promotion, but I just initiated this topic like 2 years, for 2 years. So yeah, that's all. Thank you so much.
Thank you.
Thank
For that
you.
very interesting and comprehensive presentation. In lots of ways, obviously a very challenging area to work in, with a vulnerable population in many ways, and yet sensitive interventions required at lots of levels. So thank you very much. I'll have another go at pronouncing your name. I won't say Sharon, that's too anglicized, or Western, Dr. Xueling Xiao. That's my best shot at it. So on that note, I will, in previous open talks, I've first of all gone to Peter Harmon and then to Yua Li, your colleague in Changsha, and I think then perhaps Mehmet, but we can do that this time, and I can just throw it open to the floor for any comments or questions.
Just slow, Joe, not too hard.
Peter, did you have a?
Well, I have actually a question or two questions. Thanks very much for the presentation. I'm always wondering, and that's not just China, that's since we know about, or we don't know about HIV, there are, for me, two things. The one is new health issues coming up, and that was HIV, that was the Black Death, that was whatever it is, unknown, and then actually blaming the victims. That's something I experienced, at least here in Europe at the time. It was first blaming the victims because of their lifestyle, be it homosexuality, be it drug abuse, and actually aid discrimination, trying to get them out of the way, in this way discrimination, and a fear that was actually, and this is my little bit my struggle, the fear of something that had not been actually blaming the victims, but that had been some mystification, something sent by God or by Buddha, I don't know what, but something that was getting out of control. Where people, the good people, thought there's something happening out of control, and it's a sign by nature, by God, by I don't know what, that we should change in general our lifestyle. That we should, and that's then this discrimination. that we should actually lead a life now in the Western societies, if you would be Christian or not, it was the emphasis. There is something like the Ten Commandments, and we should live according to them. Women can say something probably similar from the Muslim background, and you have it in any religions. So this kind of mystification, discrimination, how this links, and then how we can stop it, how we can actually get a rational approach to it. You presented part of it in terms of the medical side, but what would be your stance then of extending this, having influencing the society? You mentioned something, education, changing the lifestyle, but what is with us, I say now provocatively, who are not affected, who are afraid of something is happening in absolutely irrational terms, how to overcome this?
Yeah. So actually, yeah, as Professor Peter said, that I have more focus on the medical perspective. Actually, actually in our group we have like we also have a small group focus on the discrimination or social stigma part, especially for the group who focus on the HIV prevention. And so in like less than 3 years or 4 years, the UNAIDS has initiated the Yo-Yo campaign, which means that if the HIV patients has achieved the status of undetectable HIV variant node, it means that they may not transmit the HIV to others through the sexually contact. So this is called the Yo-Yo campaign. But in China, you know, from the first case of HIV in the 1985, the people, actually the society in China, we have a saying as 谈爱色变. It means that they have the HIV horrible phobia, actually. Even when they heard that some people talked about HIV, the society was people around will feel very horrible, and maybe do not want to talk with these people anymore. But nowadays, I think in China, at least in China, the society discrimination toward HIV has changed a lot. For example, since the Yo-Yo campaign, many people, actually, not in a very high level, but part of the population has known that the HIV can only be transmitted from the sexual, from blood, and from mother to the orphans. So people are not that scared of HIV anymore, and but we are still working hard for this. For example, because of the stigma or the social stigma. So as I see, the first 95% goal is to have the 95% of HIV positive people to know that they are HIV. So if the society become more tolerable and more positive, have more positive attitude toward this population, they may well have their voluntary HIV testing more frequently. They will do the HIV self-testing more frequently, so we can find them, and then we can give them the treatment, and we can give them their help them to adapt to living with HIV as well. So stigma actually is still exist in this population and also in this society as well. And another thing I want to see that besides the society, from the level of social, the internal stigma of the HIV patients is also impact their daily life, their quality of life as well. Because we always tell the patients that people cannot tell that you are an HIV positive person from your appearance. So you can just live your life as normal and just take the medications, do the exercise, and have some healthy diet, just as normal people. But yeah, I totally agree that we still have some stigma and discrimination toward this population, and also for the people who are at high risk of HIV infection, especially for the male who have sex with men. They are suffered from double stigma because of their homosexuality and also the potential of being infected by HIV. Yeah.
Thank you, Xueling, for that.
Yeah.
Do any other of our panelists have questions or comments?
Can I ask something?
Mimish, yes.
So first of all, thank you for your presentation. And my question is somehow necessarily linked to Peter's question, because medicine is really your field. But my question will be similar to his question. But you answered it already a little bit. So I wanted to ask what the perception of HIV infected people is, and how does it differ in urban and rural areas? And as I said, you have already answered this somehow. You said there are still certain forms of stigmatization. But I wanted then to ask, what is the mechanism to get this feedback? So do you have any mechanism in your medical working group, let's say, to get this feedback? Some sort of mechanism about these still existing prejudices, what you mentioned, stigmatization of certain people. You said that this still exists, but then you have to have certain mechanisms to deliver this information. And I would like to ask about these mechanisms. Are they organized, structuralized, or are these only personal feedbacks which are given by parts of the population? This would be my question. So the structural organization of feedback. Then how I would also like to ask, is there any cooperation between your medical support activities concerning these people and also civil organizations or other organizations? Are there networks in this context? This would be my question. There are two questions, but they are, of course, linked together. Thank you.
Yeah, thank you. I just want to clarify also whether I have understand your question or not. So first is about the discrimination and how the feedback mechanism from the such as the research, this population, and the government thing. And the second is about the some other network or to support this population, right? So for the first thing, so as I said, we from the first case of HIV, our social from the social population, they when anyone talk about HIV, they may feel horrible and scared and do not talk to that people anymore. But actually, our government and also especially the CDC office they have noticed that thing. As I have introduced in my PowerPoint, that the CDC is responsible for the evidence synthesis as well. So one way for them to get the feedback from the research, from the population, is that they can get things from our research during the evidence synthesis. And also, actually, it's also I can answer the second question as well. We have besides the government level, we have a lot of NGO as well for this population, and so actually, for example, for the scaling up of HIV testing, we can do it in the hospital, in the CDCs, and the majority of them actually, we do the HIV testing for the risk populations in the NGO setting. Because, for example, our group has cooperated with like 4 to 6 NGOs. They are the male who have sex with male, but some of them are HIV positive, some are HIV negative as well. And then they are much more close to the risk population and also to the HIV positive population, because they are in the similar context, they are in the similar condition as well. So this is a second feedback mechanism. And also, actually, nowadays, our government, now we try to, before all of the HIV patients might get treatment or get service in a designated HIV clinic or HIV inpatient department, or in the CDC office. But nowadays, we have tried to move this device, the documents of the HIV patients, from the CDC office or the HIV clinics to the community level. So we treat the HIV just very similar as the other diseases such as hypertension, diabetes. Because now, we always start with a sentence in our paper that HIV is a chronic disease now because of the treatment. So they can also give some feedback through this community level, but the majority of the feedback is from the research and also from the NGOs, especially the NGOs, because the CDC office will have like group meeting with NGOs at a regular frequency, like maybe 2 to 3 times per half year, but I'm not very sure with this frequency. And so the NGOs works a lot for them. And I think so for the second question, we now have the very normal organizations to support them, and also we have the NGO, non-organizational, non-governmental organizations for them as well. Yeah.
Thank you very much.
Yeah, thank you.
I don't know if you had any particular comments or questions.
I do. Thank you. Yes, I do. Thank you very much, Professor Xiao. Thanks for your wonderful speech and presentation on the HIV management in China. Okay, so I am a little bit more concerned with the human rights protection. Not long ago, I think last week, I noticed the United Nations, they published a report calling for the leaders in developing countries, and of course, including especially the African country and also Asian countries. They have to pay more attention to the HIV, and also yes, they of course they said they have an aim that the HIV would be hopefully be eradicated.
I cannot hear you. Yeah.
You cannot hear me?
Yeah, it works now.
Okay, good. Yeah. So yeah, I noticed not long ago the United Nations, they published a report. Yes, so on one hand, they call for the leaders, national leaders, to pay more attention to the HIV. Of course, they need to input more resources to manage the HIV. On the other hand, they set the aim that hopefully the HIV will be eradicated by 2030, if I am correct. Yeah. So, but so the reality actually now is we are facing the economic downturn. And I noticed in your report that in your presentation that the government still they have to play a very important role in managing the HIV. So I would like to know that what is your observation toward this. And so this is one question. And another question is also in the report I noticed the women and children, they are the principal victims of the HIV, and especially in terms of human rights protection, because they would experience coercion, mistreatment, and other so these things. And in the HIV, if they are the HIV they are the affected, they would be the most marginalized group. But the report they mentioned a lot the situation of the mothers and also the children in less developed countries, especially in African country. I would like to know so what's the situation in China? So in China, so it's the similar case that the women and their children are the main victims. But I noticed that during your diagram, it seems not. It seems that the men, the percentage, I noticed that, through the sexual contact, they are the homosexual, including like men and men. So so what's the human rights protection, especially the different groups of people in China? So is there any difference?
Thank you for the question. So for the first, actually in China, so the culture and also the system of of China and also the Africa countries are very different. So in our country, the government role is very important, especially for the money, right? Because we have not we need a lot of financial support to for the HIV prevention and the HIV management as well. I totally agree that the government's role is very important. As we discussed that the feedback mechanism and how the government implement the strategies and make the policy is very important. But in Africa, actually, as it's very depend on the culture and especially the role of the government. But you see, as you see that is the document is proposed by the United States, right, and also the UNAIDS. So it means they will give the financial support for the African countries. I know that, for example, my mentor in Johns Hopkins, she has a lot of program which the study setting is in African countries. So the United States government gives the money to them to conduct their study, such as the HIV testing scaling up program, and also for the treatment thing, for the treatment adherence facilitating as well. So maybe they still need to concern for the money things, but they can have less concern because the United States government will pay for that. And also I know that I just know some of the situation because I'm not very familiar with all the Africa countries, but some Africa countries, they have not NGOs. I know one of the very big program which focuses on the HIV testing. They just distribute their HIV testing device through the NGO. So the people at high risk can get the HIV testing free. Just so the situation is kind of very similar to ours, like maybe 5 or 6 years before in China. So I agree with that. The government role is very important, but it may depends on how the country works under the guidance of the government. And for the second question is that you see from the diagram, from the figure of my on my PowerPoint, actually the HIV infection among the pregnant women and HIV and the children is not a very big concern in China now. But it is concern like in maybe more than 10, 15 years before in China. But now it's not a concern. Just as I say, we provide the free HIV testing for any pregnant women. So when they get pregnant, they will go visit the clinic, any clinic. The clinic has the money, because the government have give the money to the clinic or to the hospital, any medical settings. They can get the HIV testing for the pregnant women. If the women are HIV positive, then they will refer them to the HIV clinic treatment. So there will be the doctors and the nurses who worked with HIV patients will get the women to take medications. So actually, the medications can prevent the HIV to the child to a very large extent. So you can see from the diagram where our biggest concern is about the sexual behaviors transmission mode. And for this sexual transmission mode, actually, I think our government has also do a lot for them. But in China, one of the most concerned thing is about the male who have sex with men. So in China, it's not legal, right? So they cannot get married, and they change their partners. They may change their partners because they cannot stay in a relationship, because they cannot get married in China. So actually, we still work on this topic as well. Especially as we have talked, the stigma for this population is much an issue than other high risk populations. Yeah. But in other countries, such as Africa, just as I say, their situation is kind of similar to ours. But our condition like maybe 10 years before. So we still need to work on this issue as well. Yeah.
Thank you very much. Yeah, for more different groups, maybe we can talk later.
Yeah.
Yes.
Hopefully we can have further cooperation in future.
Yeah, sure. Yes.
Yeah.
Well, I would like to add something. I would like to join this discussion between you. A very, or perhaps very provocative remark, which I dare to make because I blame myself with it. I worked with NGOs for, 20 years. Now I'm speaking from the EU perspective, not European countries, but the European Union, which systematically set up NGOs because they had been nearer to the problem, blah, blah, blah. And after doing so, after a few years, they mentioned they're actually not near to the people anymore. They are huge institutions. So the old discussion about government failure, then setting up that is crazy government and cannot deal with it. And then there's this permanent move of how to overcome basically what is called in social science government failure. Because if we need NGOs in terms of doing something that the government cannot do or does not do. There's something, yeah, it's government failure. So is it about question, not question really, a comment to think further? Is it about thinking about mechanisms that overcome government failure, that complement actually by the action, or is it about improving, changing government, that government basically doesn't fail? You mentioned several measures by the Chinese government, and I think in this respect it's kind of interesting as well. The last remarks on, which brings me back to the beginning, actually, what I said. First, it had been this discrimination, and it came actually, if I remember correctly, it came from Africa, spreading then to America and to Europe. Now you said something, as much as it is in the center of society, basically, we accept it. And this gives rise to a large question in terms of human rights as well. We have this discrimination still of African country, of Latin America, of China, of Asia. I just 2 minutes ago, I got figures of China actually economically catching up. And this is always the two sides. On the one hand, you have the objective poverty, so-called underdevelopment of certain regions, countries, and then you have what Gunnar Frank called the development of underdevelopment, meaning the rich countries, the center countries, systematically bring other countries into a situation where they cannot cope with it, where they cannot develop medical equipment, where they stick to traditional behavior, including in many cases in Africa, you find it, Latin America as well, discrimination of women, all these patriarchal structures. Overcoming them means, I think there is this connection of having conditions to understand behavior, individual behavior, social structures, and government behavior, be it failure or successes. Government, whichever you mentioned, the different levels, but there are other aspects too. We talk about governance today, to have an integrated approach there, not to think of what is very important, what you do about individual diseases, if you want, but to say this is part of, and there you mentioned it's like diabetes, it's like heart attacks, it's like nervous breakdowns in modern societies, which are very common. To say we have to think about like changing society. It's not changing individual behavior, but changing society in a way that people are able to cope with it. It's funny actually when we talk about HIV, we talk about drug abuse, and at the same time, rich people are permanently abusing drugs in many cases, including artists, not all rich, but there it's kind of, they can afford it. They can afford clean needles, they can afford good drugs, whatever it is, clean drugs, whereas people living in poverty cannot. They are pushed into certain areas of life where they cannot live up to certain rights, let's say it in this way. So I think in this way it's pretty large, it's pretty abstract at first sight, but it's very concrete then to think about a different understanding of human rights issue, different understanding of what humans are, how they can cope with life, with individual and in society, and how society can cope with people.
Yeah. Yeah, I totally agree with what you have said. Actually, so from the perspective of nursing, we always do the research and considering any question from the level of individual, and we always take other level such as social, organizational, interpersonal. So other levels, we always take it as a compounder because from our nursing perspective, we the most modifiable things is from the individual level. But from the human rights perspective, yeah. So we need to do a lot besides the individual level. We need to do a lot regarding the social, the governmental level, the interpersonal, the society, the community, and so on. Yeah, yeah.
Okay, thank you for that
Thank you.
response to Peter's wide-ranging observation. And on that note, unless there's any other comments, I've changed my location. You might notice my battery is running low, so I've just gone to the plug. In fact, so I'm peering into the phone at this point. So this has been another last Friday presentation from the HRUG Open Talks, sponsored or anchored in the Human Rights Center in Central South University in Changsha. And behind Peter Herman, you'll see the lovely blue logo of the university. I guess all going well, our next last Friday talk will be in August, the 30th of August, in fact. So for those of you subsequently viewing this, please do tune in on Friday, the 30th of August. It remains for me to thank our panel, Peter Herman, Human Rights Center, Central South University, Changsha, Yua Li from the School of Law, Central South University, Mehmet Okayu is from Middle East Technical University in Ankara, myself, Joe Finnerty from University College Cork, and above all, I got this written down so I pronounce it correctly, Professor Xueling Xiao from the Changsha Nursery School in Central South University, and thank you so much for your very interesting talk today. So thank you, everybody, and have a lovely weekend.
Thank you very much.
Thank you.
Oh,
Nice
thank
weekend.
For
you.
the opportunity.
Nice weekend.
Yeah.
Bye, everybody.
Bye.
Have a good day.
You.
Bye.
Bye.
You, bye.
Bye.